Greetings everyone. So today, as you can read from the slide, I'd like to present about rheumatologists and let us unravel the intricacy of gout, a condition affecting millions worldwide. Besides, in these presentations, we'll explore what's the body system involved and understand its relationship with the gout disease, in which we'll explore about the joints involved. Then I'll share one of the best rheumatologists in Malaysia, which can be as our role model to become one of them rheumatologists in the future. Hence, let's get ready for a journey to better health and knowledge. Let's get started. So, first, it's good to know the presenter and also the researcher of this work. So, hello everyone. I am Naison and graduated from Labuan Matriculation College. I am now pursuing my study in Bachelor in Doctor of Medicine at University Malaysia of Sabah, and I am currently a first year student. So the reason I chose rheumatologist, which I specifically studied about gout disease, is because my father suffered from this disease and I like to know more. So I really can understand my father's life with gout. Without further ado, let's get ready for an engaging session filled with insights, discussion, and perhaps a few surprises. Let's dive in. So what is actually a rheumatologist? What is their work? So basically, a rheumatologist is a medical professional who specializes in diagnosing, treating, and managing diseases of the joints, muscles, and bones. You can find rheumatologists in the hospital, in rheumatology department. So the question is, what is the body system involved in studying the rheumatology? It's basically for both the bone and muscles. Hence, it's important for musculoskeletal system. Basically, these two systems have the same function which will produce movement. So if there is something wrong with them, we can't do our daily activity normally. We'll be having difficulty to work, to write, or even to wake up from your own bed. Therefore, as for musculoskeletal, its component includes skeletal muscles which will produce movement for the body, whereas for skeletal muscles system, its component include bone, joints, and cartilage, which become complementary to muscular system since it will provide attachment for skeletal muscle, which subsequently aids in movement. I hope you get something new here. Since we will dive into the realm of gout disease, so we'll discuss more about the joints. Imagine a symphony of movement where every bend, twist, and flex tells a story of resilience and strength. Thus, after this, we're going to explore how joints work, why they're so cool. It's going to be a fun and eye-opening journey. Therefore, based on Principle of Anatomy and Physiology 13th edition textbook, joints is a point of contact between two bones, between bone and cartilage or between bone and teeth. Its function is to hold bones together in ways that allow movement and flexibility. Besides that, joint can also be classified into fibrous joints, cartilaginous joints, and synovial joints. However, let us look further only at the synovial joints since it has the most relationship with the gout disease, since it's actually a movable joint in the body. We are surprisingly and factly have 6 types of synovial joints that can be found inside our body. First, plant joint. Let's talk plant plant joint in your foot. Imagine your foot as a well-coordinated team of joints. The plant joints in your foot are like tiny sliders, allowing the bones to glide smoothly against each other. So when you wiggle your toes or tilt your foot from side to side, it's all thanks to this awesome plant joint, keeping your foot movement flexible and smooth. Thus, for example, is between navicular and second and third cuneiforms of tarsus in foot, which shown in the picture. Second, we have hinge joints. A hinge joint works like a door hinge. It lets bone move back and forth in one direction. Like when we bend and straighten our arms or legs, think of opening and closing a door. That's how a hinge joint allows certain parts of our body to move smoothly. It's a simple but important type of joint for our everyday activities. For example, it's specifically located between trochlear of humerus and trochlear notch of ulnar at the elbow. Third, we have condyloid joints. Condyloid joints are like versatile joints that let you do many cool movements. Think of them as a bit like a joystick on a video game controller. These joints in your finger, for example, allow you to bend, straighten, and move side to side, so they are kind of like the all-around charms of your body's flexibility team. For example, it's specifically located between radius and scaphoid and lineate of carpus, which is wrist, just like in the picture. Fourth, we have pivot joints. Pivot joints are like the spinners of a toy top. They let bones twist around each other. Imagine turning your head left and right. That's your neck pivot joints at work. It's like having a built-in swivel of your body, making it easy to look around and check out your surroundings. To be exact, we can also find them in between head of radius and radial notch of ulna. Fifth, we have ball and socket joints. Ball and socket joints are like the superheroes of joints. Picture a ball, the rounded end of one bone fitting into a socket, a hollow space in another bone. These joints, like your hip and shoulder joints, allow awesome movement in almost every direction, just like how superheroes can move in lots of different ways to save the day. We can specifically find these joints in between head of femur and acetabulum of hip joint. Last but not least, we have saddle joints. It's basically just like a saddle on a horse, and we can specifically find it between trapezium of carpus and metacarpal of thumb. And now, let us discuss about the gout disease. So what is gout? Gout is increase in total of body urate pool, which is concentration of serum urate is more than 6.8 mg per dl, which causes urate crystal to form and precipitate in and around joints tissue. We can diagnose this disease simply through patient symptoms such as warmth, swelling, erythema, and pain of abrupt onset in the involved joint. Also through blood tests where we measure the serum uric acid, and also through synovial fluid aspirations where we examine for the presence of uric crystals. It is in needle shape and can be identified using polarized uric acid crystals. So first, medications. For example, anti-inflammatory drugs. Second, lifestyles, medications, dietary intake to reduce purine intake, comprehensive care, addressing comorbidities that may contribute gout, and from dietary guidance, a balanced diet that consider purine content, hydration, encouraging regular fluid intake to help the kidney excrete uric acid more efficiently, medication adherence, consistencies in use of prescribed medications. So it's basically related to musculoskeletal because gout affects primarily in the joints. Commonly at big toe, the inflammatory response triggered by this crystal affect the musculoskeletal system. For example, affect mobility of an individual. So this is basically the summary of what I have just discussed. Feel free to pause and read them. We have finally come to an end. So last but not least, one of the best rheumatologists in Malaysia is Associate Prof. Dr. Raja Jasmine Begum binti Raja Mohammed. She is a rheumatology consultant at University Malaya Medical Center and UM Specialist Center, specializing in scleroderma, lupus, and arthritis. She trained at Royal Free Hospital, UCL. Her research is presented internationally and she leads clinical trials, actively involved in Malaysian Society of Rheumatologists and Asia Pacific League of Association for Rheumatology. She founded the Arthritis PPU MK Fund, and additionally, she coordinates the University Malaya Medical Program curriculum at the University of Malaya. So, these are the references that witnessed my journey, giving all credits of my presentation and info to all of these books. Thank you for your attention and see you again.